Most of us had been ordered or at least asked to stay at home, including ONR reporter and producer Jason Doyle, who joins us now via Zoom. And Jason, first responders, they don't have that option.
That's right, Rich. In addition to our remarkable doctors and nurses, the frontline troops in the war against the virus are Oklahoma's police, fire, and emergency medical technicians. They've seen what's happening to their colleagues in other cities and are taking special precautions before going on any emergency calls.
Anyone who says this situation is a New York City only situation is in a state of denial. You see this virus move across the state. You see the virus move across this nation.
New York, the hardest hit American city with more than 25% of the recorded positive tests for COVID-19 in the United States. That city has lost 3 police officers to complications from the virus over the previous weekend.
We have to find a way to mourn, but never be paralyzed, because people's lives are at stake, and we have to be there always for those we can save, those we can comfort, those we can help.
So far, that hasn't happened in Oklahoma, where healthcare leaders are bracing for the impact the virus is expected to have here.
We've been very fortunate so far that we have not had any officers test positive. Now, as this virus spreads, that's probably going to change, just like it has in other cities.
The Oklahoma City Police Department has changed routines to help keep the virus from spreading among its ranks.
We are not doing lineups at this time. As officers need information, if a supervisor understands or learns that there's information that needs to be passed on to the officers, he can do it via computer, via a phone, but they are not calling all of the officers into the lineup room.
The Oklahoma City Fire Department is making changes to its approach on medical calls as well.
We're sending one person to the patient's side, and that one person is going to be wearing the appropriate mask, eyewear, gloves, even a gown if necessary, and they're also going to put a mask on you, the patient.
Fulkerson adds that firefighters are already equipped with some of the best protective equipment available.
One of the great things about being a firefighter during this time, we actually have, because we use structural firefighting gear, we have those SCBAs, those self-contained breathing apparatus that you see, the big tank on our back and the big mask on our face. That is actually the very best level of respiratory protection that a first responder could wear. And we even are utilizing those SCBAs as a backup plan, even on our medical calls now.
Of course, that's not all the protection officials want for first responders as the outbreak continues. A group of Oklahoma House members is calling for emergency workers who might contract COVID-19 through work to be covered by workers' compensation. The Oklahoma Attorney General's office has issued guidelines to reduce law enforcement's exposure to people who are possibly infected. And the Oklahoma State Department of Health is overseeing aspects of emergency medical response by paramedics and EMTs across the state.
They are responding in a situation that we haven't seen before, and really anything that we can do to help them out, obviously, we want to. So for people out there, if they do have an emergency call, just make sure that you give them all the information that you have so that they can be properly prepared.
If the medical call is a possible case of COVID-19, the EMTs and paramedics will gather as much information as they can before responding.
I think just giving them as much information as possible. If you are calling with suspected COVID situation, I think it's important, and this is important for everyone in this reality that we're in right now, is be really judicious with remembering your contacts, who you've had contact with, where you've been, things like that.
Information is critical for fire and police calls as well.
If you're calling someone to your house, a police officer to your house or your home, you should expect the call taker to ask you some screening questions. Is there anybody in your household that's sick? Is there anybody that's been exposed to COVID? Things along those lines. Anybody presenting symptoms at this time of COVID?
Anyone that may be coughing, obviously having a fever, those are things that we want to know about. If they've already been tested, for instance, if they know that they're positive already, or if they've been around someone who's positive, those are things that we want to know.
Remembering every person you've had contact with is of vital importance to public health officials.
That's the first thing that the health department, the Oklahoma State Health Department, does, is do that contact tracing to figure out if there could have been exposure beyond you.
While COVID-19 is a new scourge, police, fire, and EMTs are familiar with the dangers posed by contagious diseases.
For example, HIV, hepatitis, those type of things have been around for a long time and are certainly contagious. We've dealt with those for many, many years.
It does seem that people are beginning to take precautions, at least if you count the number of 911 calls in central Oklahoma.
So normally we would run about 220 calls on an average day, but right now we're down around 170 or so calls a day. So the number of calls is down. Leading up to this weekend,
Fulkerson hopes that's an anecdotal sign Oklahoma is bending the curve. Let's hope he's right. Jason Doyle, the Oklahoma News Report.